BAPS Wellness webinar titled Preventing Cancer for All Ages. Tonight's session is part of the BAPS Wellness initiative, which is all about promoting lifelong health through nutrition, exercise, sleep, and stress management. This holistic approach is inspired by the values of our gurus Pramukh Swami Maharaj and Mahan Swami Maharaj, whose teachings remind us to care for both body and mind. We're delighted to have you join us. My name is Sapna, and with me today is Neil Bai. We are both doctors and also volunteers in the BAPS healthcare team. Today's webinar is on cancer screening and HPV vaccination. Whether you're here for yourselves, a family member, or simply to learn more about your health, we're really glad that you're here. Cancer is a scary word, and no one wants to contemplate ever being told that they have it. However, it touches almost every family, and its impact can be life-changing. Across the world, millions of people are diagnosed each year, often without warning. But there is hope, and it lies in prevention and early detection via screening and vaccination programs. These tools give us a real chance to act early, reduce risk, and save lives, making awareness and action more important than ever. In today's session, we'll explain what screening options are currently available to us for free and to what extent our lifestyle can impact on our health. We're fortunate to have two very experienced speakers with us today who will be sharing their insights and answering your questions. We have Professor Sanjay Popat, who is a consultant medical oncologist at the Royal Marsden Hospital and Professor of Thoracic Oncology at the Institute of Cancer Research in London. And we have Dr Heena Ruparelia, who has been a GP for over 20 years in Leicester and has a specialist interest in women's health. Please feel free to type your questions in the chat throughout the webinar, and we'll try our best to get through them all. And there'll also be some useful web links and documents on that chat for you. I'll now hand over to Sanjay Bhai to explain the importance of screening to us.
Just and good evening, everyone. I'm going to speak to you about what you can do for yourselves and your children to prevent cancer from occurring and keep it at bay. So many people say to me, what is cancer? Exactly what is it? So we all know that we are composed of millions and billions of cells, and our cells grow in our body and they're under very good control. For example, if we cut ourselves, our skin cells will grow, divide, replicate, and then stop growing and dividing and replicating when the cut is healed. However, with cancer, one cell grows into two, two into four, four into eight, eight into 16, 16 to 32, 32, 64, etc., and it's completely out of control. And this is a bad thing. So, for example, imagine if the cells in your bowel, in the picture on the right-hand side, are growing in a completely chaotic, unregulated manner. Soon, after a period of time, you won't just have one cell, you'll have millions of cells. And those millions of cells will form a lump. And that lump will cause a problem. And these cells, when they cause a lump, are called cancer. And these cancerous cells grow and they travel in the bloodstream and the lymph stream. They go to other parts of the body. They go to the liver, they go to the lungs, they go to the brain, they go to the bones, they go to other parts of the body, and they take over the body. And that is what ultimately causes our demise. So it's really important we can do whatever we can do to prevent cancer from occurring, or we can pick it up at a stage where it's still absolutely tiny, is not causing a problem. It can then be cut out or eradicated where it's not then causing an issue. Now, why is this important? Because over our lifetime, cancer will affect 1 in 3 of us. It tends not to affect young folk. It tends not to affect people in their 30s and 40s. The problems start coming when we're in our 50s, 60s, 70s, and 80s. That's when the real issues are. So it's very important we try to understand what cancer is, and we try and prevent it and pick it up early before we know that there are problems inside. So a few things I want you to think about, because there are many myths about cancer. The first myth that I often see in my clinic, people say to me, I go to Monday, people say to me, I don't need to worry about cancer. It doesn't affect vegetarians, and I don't smoke. It doesn't, it's not a problem for non-smokers, so I don't need to worry. Actually, the truth is cancer can affect everyone, regardless of diet, smoking, or alcohol. It's absolutely important that all of us are educated about the risks of cancer and what we can do to prevent it. The second question they always say to me is, well, cancer can't be prevented. So what's the point? It's going to happen to us anyway. Our gurus are looking after us. We don't need to worry about it. Actually, no, that's false. Cancer can be detected through screening, and it can be prevented, and it can be cured when caught early enough, especially if it's picked up without you knowing that it's there, without you knowing that you have symptoms. Third myth that we often hear is, NHS has got lots of problems. It's really bad at picking up cancer, so therefore it doesn't really offer much. What is the point? Actually, no. A lot of what the NHS offers, especially the cancer checks, are available free of charge. And if you don't know about what these cancer checks are, then you won't be able to participate and take advantage of all this free activity that you can take part in to minimize your risk of cancer and to pick up cancer before it causes a problem at a point at which it's curable. The fourth question that we often get asked is, well, look, cancers are fast growing, right? This is an emergency. I need to deal with this now. Actually, no. Most cancers take 10 to 20 years to develop in the human body. So there's plenty of time to pick these up early. Really important. You take control of your body. You understand what your body behaves like, and you participate in screening. And the final myth is, people say to me, well, look, you can only vaccinate against infections like, for example, coronavirus, or against hepatitis, or against meningitis. You can't vaccinate against cancer. Actually, no, you can vaccinate against cancer developing, and the NHS actually offers this for free. Did you know that? Okay, I bet a lot of people didn't know that. Now, one of the things I want to focus on is preventing cancer through screening, or picking it up early through screening. Now, the best way we can prevent cancer or find it when it is curable is through screening. Screening means having a test to detect early cancer before it has taken hold, or before it has developed, so it can be cut out or it can be eradicated. And you know what? Us Asian patients, us Asian population are far less likely to take part in screening. And it's one of the many, many reasons why we have cancer as an issue in our population, alongside many other issues that we have. So I'm going to tell you about what is available to all of you free of charge, and you must participate in this. So if you're on this call and you're listening to this and you are female, you are very, very lucky, because two of the most devastating cancers that affect females are cervical cancer and breast cancer. And guess what? You can screen against them. You can pick it up early before it's causing a problem, and you can potentially cure these cancers through screening. And you know what? A lot of people just don't know that. They don't participate in that. So cervical screening is completely offered free of charge to all females, starting at the age of 25 up to the age of 64. You will be contacted, if you're female, by your GP practice. Do participate in this. You will need to go and see your GP practice, usually a female nurse, who will talk you through what the screening involves. Breast screening, please make sure you listen to our BAPS webinar on female health and breast cancer. Really, really important. But all females on this call from the age of 50 onwards will get an invitation to participate in breast cancer screening. This essentially means attending a unit in the GP practice, or a van, or some sort of health centre, to undergo an X-ray test called mammography of the breast, and this is the best way we can pick up early lung cancer or early breast cancer before it is a problem. And this is offered every 3 years. Now, you men on the call are sitting thinking, well, actually, look, what's in it for me? I'm worried about prostate cancer. So for the first thing is you don't need to be too worried about prostate cancer. Prostate cancer is not a big problem to the majority of the demographic on this call, which is people who are young. You can think about prostate cancer screening using a blood test called a PSA test, and it's only really suitable once you reach the age of 50 and above. It's not offered routinely because you know what? A PSA test is not a very good test because PSA levels get bigger, get higher as we get older. And there are many reasons why a PSA test may not pick up prostate cancer. And there are many reasons why you may have an abnormal PSA test but not have prostate cancer. So there's a lot for you to talk about with your GP once you get to the age of 50 to see whether a prostate PSA test is the right test for you, because it may be, but it may not be the right test for you at that point in time. Now, both men and women listening on this call, once you get to the age of 50, you will get a letter notifying you that you will be eligible for bowel cancer screening. Please, please, please do not ignore this. Following that letter, you will get a tube, a packet that comes through your letterbox where you have to do something that you're not very used to. You have to collect a sample of your poo. You've done this to your kids. It's not a big deal. You collect a sample of your poo from the toilet, you put it into the tube and you pack it, and it goes in the mail in the usual mailbox that you post your letters with. It's completely safe. And then a week or so later, you will get a reply back to say whether you need any further action on this. This doesn't tell you whether you've got bowel cancer or not, but it tells you whether you need further tests or not. I can't emphasize enough how important it is for everybody from the age of 50 and above to participate in this. And if you're at risk of developing lung cancer, which essentially means you've been a smoker in the past or you are a smoker, your GP practice will be starting to reach out to you to talk to you about what the risks are and see whether you are eligible to have what's called a CT scan. Now, you can actually prevent certain types of cancer through vaccination. And indeed, in the UK, we are now offering what is called HPV vaccination, which is available for children, for boys and girls. And it is the best way to reduce the risk of head and neck cancer and also cervical cancer in females. So what is HPV? It's a very common virus. It's usually harmless, and it can cause some cancers, particularly some types of head and neck cancer, not all types of head and neck cancer, and some types of cervical cancer, not all types of cervical cancer. And you know what? If you get the HPV vaccine, it gives you 90% protection against the HPV vaccine, which massively reduces your risk of developing head and neck and cervical cancers. In fact, it is so active. It is now offered routinely to boys and girls at school between the age of 12 and 13. We need parental consent to do this. Now, if your child has already missed the vaccine because for whatever reason, speak to your GP practice because it is available up to the age of 25. Now, in our population, we love our Soparia, we love our betel nut, but you know what? Please try and give this up because it does increase the risk and undoubtedly causes mouth cancer. You know what? Sopari is a class 1 carcinogen in the same class as tobacco is. Did you know that? Most people didn't know that. WHO classifies it as a class 1 carcinogen. It causes mouth cancer. And you know the slate lime that we put in balm, that is also really not a good thing because it really irritates the mouth lining, allowing the Sopari contaminants to cause cancer much quicker. And so you'll say to me, look, well, I don't have actually balm with Sopari, but I'll have balm masala, which has Sopari in it, that has the same risk of mouth cancer. Please try to give up Sopari if possible. If you're confused about cancer screening, take a copy of this QR code, look it up, put in your age, put in your gender, and it will tell you what type of screening you are eligible for. So in summary, all children should get an HPV vaccine between the age of 12 and 13. If you're female, from the age of 25, please, please, please participate in cervical screening every 5 years. From the age of 50, please, please, please participate in breast cancer screening every 3 years through mammogram. If you're a male above the age of 50, have a chat with your GP about prostate checks, whether it's worth it, whether it's not worth it. There's a pros and cons about it. For both men and women on this call, from the age of 50 and above, please, please, please do not ignore the bowel cancer screening tube when it comes through the post. It may save your life. And all of you, if you've been smoking in your past, or your current smokers, please make sure you touch base with your GP and don't ignore the telephone calls and letters about lung cancer screening from the age of 55 and above. Thank you very, very much for your attention, and in due course, happy to take questions.
Thank you very much to Sanjay Bhai for those key messages on cancer screening. I think he really drove home the point about taking up all the opportunities for screening that are available in the community. If you missed it at the start, that's Professor Sanjay Popat. He's a consultant medical oncologist, and he'll be taking some of our questions soon as well. So now to introduce our second speaker, as we mentioned earlier, we've got Dr Heena Ruparelia. She's a very experienced GP, and she's going to be speaking to us about lifestyle changes that can help to prevent cancer. Another reminder, please do type any questions you have in the chat and we'll try and take them later. And we'll also be sharing some useful links as we go along. Dr. Heena.
Hi, good evening, everyone, and Jay Saminan. Can you see my slides okay? Yeah.
Yes,
so I just want to talk today about cancer prevention. So that was a really useful talk by Professor Sanjay Bhai there. But there are things that we can do every day in our lifestyle to try and help prevent cancer and try and reduce our risk. So there is good news. 40% of all cancers could be prevented through lifestyle changes. We're not saying that all cancers can be prevented, but many can be reduced. So this really looks at our kind of healthy eating and regular activity. And the main kind of message here really is that positive changes are beneficial at any age, and it's never too late to start. So first of all, I just wanted to touch on smoking and cancer, like we just discussed. We all know that smoking exposes the body to thousands of chemicals, and it's a major cause of lung cancer, mouth cancer, throat cancer. But I also wanted to talk today and just make you aware that vaping also carries risk, as well as smokeless tobacco, as mentioned, such as pan, sopari, betel nut, and also things such as shisha. One fact that I came across is that a 45-minute shisha session can be equivalent to smoking up to 100 cigarettes. So we just need to be aware of these other kind of tobacco in other cases as well. But quitting at any age improves health, but just be aware, like we mentioned earlier, lung cancer screening is available on the NHS. Now, also want to talk about nutrition and cancer prevention. So this is very important because a good diet and good nutrition affects our body weight, which can have a direct impact on cancer risk. A good diet also supports a healthy immune system, and that also affects our cancer risk, and a better immune system and less inflammation reduces our risk. But with diet and nutrition, it's very important to look at long-term habits. So we want to do things that are sustainable in the long term. So not short-term faddy diets, but just looking at what we can do that can be sustainable. So we all probably know this, but I'm just going to go through it anyway, that we must eat lots of fruit and vegetables. The more variety, the more colours, the better. High fibre foods are very important as well. These aid gut health and reduce damage in the cell wall in the bowel. Whole grains such as oats, brown rice, wholemeal bread and pasta, and also plant kind of proteins such as beans, lentils and tofu are very important. We do go on about high fibre foods, and that's because high fibre foods are very important for gut health. So high fibre foods are again fruit, vegetable, pulses, whole grain, and what they do is that they help food move smoothly through the gut, so that reduces the risk of bowel cancer overall. Now, foods to limit, I'm sure we all kind of know these, but foods high in salt, sugar, saturated fats, sugary drinks and snacks please try and avoid as well. And there's a lot of news at the minute about what we call UPFs, or ultra processed foods. So these are foods that are such as convenience foods, ready meals, etc. And we'd also always advise that if you can't understand any of the ingredients on the label, then try to avoid them. And I suppose all this leads back to kind of trying to cook from scratch, trying to cook home cooked meals, and try to avoid kind of those kind of processed, high sugary, high salt foods. Now, physical activity is very, very important. Physical activity has been shown to reduce at least 13 types of cancer. It improves the hormonal balance in our body, and that again reduces cancer risk. And it also boosts well-being and stress levels, and they can cause inflammation within the body, which again can increase your risk of cancer. So being active is really important. And there are kind of Department of Health or government guidelines in terms of how active should we be being? What should we be doing to be active? So the current guidelines are 150 minutes of what we call moderate aerobic exercise, or 75 minutes a week of vigorous exercise, but also doing some strength building sessions within that as well. So when we say moderate exercise or vigorous exercise, what do we mean? So moderate exercise could be things such as walking, cycling, gentle swimming, something that's quite fairly gentle on the body. Vigorous exercise is something that makes you out of breath, makes you a little bit sweaty. So running, dance, gym, any kind of football, hockey, anything like that would be vigorous exercise. But we also have to be mindful that we should be active every day. So many of us do desk jobs, we're sitting down, be mindful of that, try and get up every 20 to 30 minutes, have a walk around, try and get outside. So that's important, just to be active in your everyday life, and try not to do all your exercise just in one day and say, oh, well, I've done the 75 minutes. I also say to my patients that try and choose activities that you enjoy, because you're more likely to stick with something if you enjoy it. So doing exercise with other people can be very motivating, so you're accountable for something, but try and do something that you will stick with and enjoy. Something that's quite close to my heart, so many people may have heard about Park Run. So this is a kind of a free timed 5k walk, run or jog every Saturday. There's thousands across the country, so there'll be one near you. And this kind of incorporates exercise in terms of you're doing something with other people. It's regular, it's every week, it's free, you're outside, so it improves your well-being as well. So it's very kind of well, it's readily available, and many GPs are prescribing it now as well. And lastly, I just want to touch about sun safety. So yes, we think that we've got darker skin, so we may be immune to this, but no, it's very important to kind of protect ourselves from the UV radiation, and the sun can damage our skin cells as well. So make sure that if it's very hot or sunny outside, use shade, cover up clothing, and use a good sun protection factor of more than 30. Lastly, I just wanted to touch upon the NHS that many of you hopefully have or is ready available to everybody to download. On here, you can see your screening invitations, and if you've missed any appointments, you can see them on there as well, and you can then contact your GP if you haven't got a number to contact to say that you've missed an appointment but you still want to go. Your GP can help you with that, but there's lots of information within the app, and so it's very, very useful to use. So the key messages really are to try and eat well, try and move daily, but try and build up habits that you're going to kind of continue for life. So starting small, and just building upon that, and that can greatly reduce your cancer risk in the long term. Thank you.
So thank you very much to Heena for that talk. We're now going to move on to a rapid fire question round, after which we'll be taking some questions that are coming through on the chat and that we've been receiving separately as well. So please do continue to post there. But I'm going to ask a few questions now, both to Sanjay and Heena. So Sanjay, first question, and a rapid fire with some short answers would be, can screening ever miss cancer?
Very rarely is the answer, very rarely, but essentially what it sometimes picks up is very early cancers that are starting to develop, which needs to then be kept an eye on. So this is called a false negative rate. The rate is very low. So you should definitely have screening, and the probability of it missing cancer is very low indeed.
Thank you for that. Heena, the next one for you is, are these screening tests painful or uncomfortable?
Well, yes, having a vaccine can cause very short-term discomfort. A mammogram can sometimes be uncomfortable, but that's nothing compared to kind of trying to prevent a cancer or trying to pick something early that can be potentially treatable. So I think that short-term discomfort is definitely worth it in the long term.
Okay, thank you. Sanjay, the next one for you is, if you feel fine, do you still need to go to screening?
Oh, absolutely. You are then exactly the right person that should be getting screened, because you want to pick up cancer before you know it. Because if you've got cancer and you don't know it, then it's what we call very early cancer. It's curable. If you've got symptoms of cancer, it's probably already too late. So if you haven't got any symptoms, that's exactly when you want to get screened.
Thank you very much. Heena, the next one for you is, what is my chance of getting cancer if I've tested positive for HPV?
So you may have had a positive HPV test. That would mainly be through cervical cancer screening, and that doesn't mean you've got cancer. That means that you're at a slightly higher risk, so you may have more frequent testing. And the kind of evidence show that only 5 to 15% of those testing as high risk will then go on to develop cervical cancer. So the kind of screening and that extra surveillance is really important.
Okay, thank you. So Sanjay, by talking about HPV, which cancers can you get from having the HPV vaccine, HPV infection?
Well, there are many of them. The commonest ones that we worry about are certain types of head and neck cancer and certain types of cervical cancer, the majority of cervical cancers. So if we want to try and eradicate cervical cancer for a generation in the future, we need to make sure that our children are HPV vaccinated. If we want to try and eradicate head and neck cancer or certain types of head and neck cancer for generations in the future, we have to make sure that our children are HPV vaccinated. If you want to do anything that's going to help your children, get them HPV vaccinated.
Okay, thank you. Heena, how long does that HPV vaccine last for, and is there ever a booster that's needed?
So if you've had your vaccine at the moment, the program is that it's offered to 12 to 13-year-olds, males and females when they're at school, so year 8, and that's lifelong. So you don't need a booster after that age. If you've had it at that age, the only time you may potentially need a booster is if you're immunocompromised or if you've got certain other kind of conditions. But for the majority of people, it's just that one vaccine. And you can have it up until the age of 25.
Okay, thank you. Sanjay, the next one for you, is cancer curable?
Short answer, yes, but it's only curable if it's caught at a very early stage, i.e. a small lump that hasn't spread from where it started. And you know what? If you've got a small lump, you probably don't know about it because it's inside you. You won't know that it's growing inside you. So how are you going to know it's there? The only way you're going to know it's there is if you undergo screening. So that's exactly why you must undergo some sort of screening if you meet that age group, that requirement, and you undergo that test. If you're waiting until it's widespread and disseminated, by and large, it's not going to be curable. You're then living with cancer, trying to control it. You have all the side effects of all the treatment, all the discomfort of all the treatment. Listen, that is such a big deal compared to the discomfort of screening. If you get an invitation for screening, you are such a lucky person to be able to participate in that. Don't give it up, because there are people with cancer who haven't participated in that where it could have been picked up early. Do take part in screening.
Thank you. Talking about breast screening, Heena, a quick question. Can men get breast cancer screening?
So, no, at the minute there's no provision for male breast cancer screening. What we would say is that if you're a male and you're worried about any symptoms in that area, then definitely go and see your GP, and you can be referred on rapidly if needed.
Okay, thank you. And the last question for the rapid fire round, Sanjay Bhai. What if you notice symptoms before you receive any screening invite or in between screening rounds?
Yeah, you must see your GP, right? Because maybe there's something going on, right? Maybe there's a faster growing cancer that's caused a problem. Maybe there's no cancer at all, right? It's just an infection or some sort of abscess or some other non-cancer problem. Engage with your GP practice and see what's going on.
Perfect. Thank you very much to Sanjay Bhai and Heena Ben. So we've got some more questions coming through on the chat and separately, so we'll start a wider discussion. So I'll ask the first question then. So Heena Ben, question for you. That's come through on the chat. So breast cancer, the screening age, as we discussed, normally is 50 to 71. Why does screening stop at that age, or can people have screening after that?
Yeah, it's a difficult one. What we would say is that if you're worried about any symptoms after that age, then definitely go and see your GP, and you can be referred on rapidly. It's just at the minute that's the age that it stops, and Sanjay Bhai may have some more kind of insight as to why it stops at that particular age.
I mean, essentially, the issue is that after the age of 70, we start running into more and more health problems, and you have to balance the benefits of picking up an early cancer versus what you're going to do about it in somebody who's also already got other problems. So after a certain point, it's not worth screening for cancer because you've got other health problems going on in your life, which are the dominant problem. And at a population level for breast cancer, it's been worked out to be about 71. But you can still opt in. So if you've had your last mammogram after the age of 71, you can still opt into your service and say, actually, I still want to carry on because I think I'm actually quite fit for my age. And if I had breast cancer, I would still want to do something about it, and I'd really actively want to do it. So you can still opt in after the age of 71.
So you don't get the automatic invites, but you can say every 3 years, I'm still here, I want my screening. And of course, as you mentioned, anyone at any age, if they've got a lump, can be referred on as an urgent referral from their GP to a breast clinic. Thank you for that. Sapna Ben will ask the next question.
So Heena Ben, what are the common red flag symptoms for cancer? So what are the worrying symptoms that we should be aware of and flag up to our GP if they occur?
Sure. So there can be many symptoms, but we would always say that if you had any unexplained weight loss, i.e. you're losing weight drastically without trying, without being on a diet, you're feeling more tired than usual, with no particular reason for that, any unexplained or bleeding or bruising, generally feeling unwell in yourself, any unusual lump, swelling, bloating, i.e. new symptoms for you, then it's important you see your GP, or any unexplained aches or pains that are just new for you. So then I'd definitely recommend that you see your GP with any of those symptoms.
Thank you. Yeah, there are so many different areas to be aware of. And of course, you won't know exactly what's important. So if you're worried about anything, please don't hesitate to discuss it with your GP, because they'll be able to then do the appropriate investigations for you. Thank you.
So the next question that's come through the chat, Sanjay Bhai, for yourself, is about, can MRI detect cancer? And often people ask about different imaging or screening or paying for extra scans here or abroad to look for cancer. So any thoughts from you on that?
Well, the question is really, what is the best test for the question that you're answering? That is the fundamental issue. MRI is very good for some things, but it's terrible for many other things. I mean, if I'm looking for bowel cancer, there ain't no way I would be recommending an MRI scan. It's a terrible test to do that. It will just give you a false sense of reassurance when actually there could be something really bad going on. So the question is, what are you actually hunting for, and then what test do you have to do to find what you're hunting for, which is why we've got no one test which is going to pick up breast cancer, cervical cancer, lung cancer, bowel cancer, head and neck cancer, etc. All of these screening tests are designed with the right test for the right question. So for early breast cancer, mammography is by far the best way of doing this. For bowel cancer, a stool test, a poo test, it's called a FIT test, is by far a better test to do than an MRI. So do the right test for the right question. MRIs have their usage, and we use them in some circumstances, and they can be very useful, but actually they can also miss a lot of things as well. So don't say, oh, I've had an MRI test, actually everything's fine, because actually you may have missed what you're looking for. The question is, use the right test for the right question.
Yes, and I guess even an MRI of the same body part can be done in so many different ways, depending on what the question is and which organ you're trying to look at would have its own set of MRI sequences. And so, as Sanjay Bhai said, asking the right question and then arranging the right imaging test is the most important way, and that's best done in the hands of a doctor or someone who knows which test to ask for in the right circumstance, using their clinical assessment, blood tests, etc., and then asking for that right test. Sapna.
Heena, next question for you, please. Is their HPV vaccine safe, and what are the side effects?
So there's no kind of major side effects. So yes, you can get local kind of irritation just from the vaccine itself. That will subside after 1 or 2 days. It's safe, highly effective. It's backed by lots of global research. So yeah, it's very safe and highly effective.
And just a follow-on question, can you have the vaccine in adulthood?
So you can have the vaccine. Is ideally you want to have the vaccine before you're exposed to the virus, as it were. So that's why it's given to 12 to 13-year-olds, and then up to the age of 25. You can have it between the ages of 25 to 45, but that's out of the kind of NHS schedule. So you may need to look privately into having it if you've not had it done when you were younger.
Thank you.
Thank you. Sanjay, by another one that's come through for you. Are blood tests any good at ruling out cancers?
The general blood tests that we can get at the GP, looking at the kidneys, the liver, etc., they're not so good. I mean, they tell us how our liver and kidneys and bones are doing, but your liver and kidneys and bones have to have quite a bit of damage from cancer before they get abnormal, and certainly you have to have usually you've got quite widespread cancer on board before they get abnormal. You're probably, or your listeners are probably talking about the very fancy genetic blood tests that people are starting to market, which claim to be able to detect cancer early. The short answer is we don't think that they are that useful at the moment, but this is an evolving field. So the NHS has just done a massive study where it's been looking at people on the street, come in, have a blood test, we can check to see whether this blood test picks up cancer. And the data is actually being presented in 2 weekends' time in an American meeting. But we already know the press release from that, which is it's not that good, and it didn't really change the pickup of cancer. It's very good at picking up late cancer, but you're going to know about that because you're not well anyway, because you've got problems, you're not so right. What it's not sensitive enough to do is to pick up really early cancer when it's so early that you can cure it in the majority of cases. So these blood tests at the moment are probably not ready for prime time. I would be very surprised if the government, once it sees this data, decides it's going to spend its limited healthcare budget on these types of tests, because there are better ways that you can pick up cancer through screening.
Thank you.
Sanjay Bhai, I have another question for you. Are cancer rates rising, and if so, why?
Yes, excellent question. So cancer rates are rising, but you know what? Because we are all thankfully living longer. And of course, cancer is a disease that occurs the older we get. So if we are having a older population because we are living longer, we are going to see more and more cancer. Now, if you look at the cancer rates and adjust the cancer rates for the age of the population, guess what? The cancer rates are pretty static. So really, we don't have a tsunami of cancer. We have people that are getting older, and as people are getting older, they are getting more cancer. But that means we still have to be vigilant. As we're getting older, we have to be healthy. We've heard from Heena exactly what we need to do to be as healthy as possible, to mitigate our risks about cancer. And you've heard from me about preventing and picking up cancer early through screening. It's really important for people above the age of 50 to participate.
Thank you. Okay, next one from the chat, which we can ask Heena, and then Sanjay, feel free to add extras, is we've talked a lot about some of the ways of preventing cancer and avoiding things, but someone's asked about the carcinogens that we should be avoiding in our lives. So if we could recap some of those, Heena, if you wanted to start.
Yeah, so I think obviously we mentioned smoking, we mentioned sopari, again, ban with the tobacco. Alcohol is another one that's highly associated with cancer as well. Any others? Yeah.
So the main ones, and actually being a couch potato is a big carcinogen, right? Sitting on the couch and not getting exercise is terrible, right? You know, Heena an absolute leader in ensuring that she's leading with exercise. So ensuring we are avoiding all these things like tobacco, smoking, alcohol, but also being active are really important.
Thank you. There's a question in the chat about whether or not ovarian cancer is hereditary. I mean, in general, if somebody in your family has cancer, if there's a family history, does that mean that that person needs to be screened earlier, or is there anything differently that would be done for them? Perhaps Sanjay, if you could answer that.
Great question. It's a question we get asked all the time, and the devil, as ever, is in the detail. So, you know, I said at the beginning of my presentation that cancer affects 1 in 3 of us over our lifetime, right? So what that means is that cancer, unfortunately, is quite common. And as we know more and more about our family, if we start asking what's going on in our family, we will find that there are people with cancer. So the question is really about, you know, what types of cancer do they have and what age do they have that, right? Because if I'm seeing cancers of ladies in the ages of 60 and 70, well, that's no big deal because that's when breast cancer happens in ladies of 60s and 70s. If I see somebody with bowel cancer at age of 75, well, actually, that's probably just common bowel cancer. But if you said to me, well, actually, there's 3 cases of bowel cancer in the age of 40 in my family, that's something that's a bit unusual, right? And so then we'd need to think about looking into that family to see what's going on. And actually, we don't need to investigate the person that's healthy because that person may not be at risk. They may not have inherited any abnormalities. You'd need to start off with the person that actually has the cancer to investigate what's going on. And that's what we do in the hospitals when we have early young people with cancer, that we want to investigate what's going on in the family. So is cancer hereditary? Mostly not, but because it affects many of us, we do find it in the family, and the details of whom it affects, at what age, what cancers within the family, then determine what the risk is of those individuals who don't have cancer in the family.
Thank you. And it's always important to disclose if there is a family history to your GP, because that will be taken into account. And when we do the referral forms, the information on there is quite important as well.
I think as a GP, when I see patients who tell me they've got a strong family history of breast or ovarian cancer, there are specialist clinics that we can refer on to that can deal with it and then look into whether they need screening early, etc. So it is important to have that discussion.
Yeah, definitely.
Thank you. Just following on that question, Heena, then as a GP, and sometimes people are worried about cancer or they have some symptoms and they feel that maybe their GP thinks that they're fine. What advice should we give those people that are worried and feel like they might want some more doing? Any advice as a GP?
Yeah, so it's something we see, quite commonly. People are worried, or they've read something in the news or a family member, and they're concerned. So I think the first thing is to, if you've been once and you felt that you've not been listened to for whatever reason, then do go back, maybe try and see another GP if you can, or, just let the GP know your concerns. So let them know that you're worried about cancer, why you're worried about cancer, and then the GP hopefully will do the necessary tests, and if required, we'll do a rapid referral. We do have what we call a 2-week wait referral pathway, which is the quickest referral pathway we can refer on if we are suspecting cancer. Now, in some regions of the country, it might take longer than 2 weeks, but we will try and refer on as rapidly as we can.
Great, thank you.
Thank you, Heena. There's a question about bladder cancer. Can it develop without symptoms? I mean, in general, when should you be worried? I mean, if there is kind of a concern that you have, should you be proactive in going to your GP and checking things, or should you wait until you start finding any symptoms? Perhaps, Heena, what do you think about?
Yeah, so if you've got, I presume you'd be worried about bladder cancer if you've got symptoms. So there can be a wide range in symptoms, but if you're having recurrent urine infections, but the main thing to look out for is any blood in the urine. So if you ever have any blood in the urine, then definitely need to go and see your GP. But I think with kind of specific cancers like that or symptoms, then definitely needs a further discussion with your GP.
Thank you. Yeah. And I think there's a few questions coming through about specific cancers, melanomas or lung cancers, bowel cancers. So obviously this webinar is mainly about screening and vaccines. We have got individual sessions we've run on chest health, breast health. Our next one is going to be on bowel health. And we've had one on men's health too. So of course, each cancer type will have its own specific symptoms, and those webinars will give a bit more individual information. So continuing on the sort of general theme of cancer prevention, some of the other questions coming through on the chat. Someone's asked Sanjay is there any information about forever plastics such as Teflon coated pans? People say that, that might increase your cancer risk.
Well, I think these are just areas of further investigation at the moment. One morning I'll read something to say that caffeine is bad for me. The next morning I'll read the newspapers to say it's good for me. Next morning I'll read something that say that something's bad for you. The next morning it will be good for you. So the problem is that the evidence that we see is quite contradictory and changes over a period of time. So at the moment, when it comes to forever plastics, we are not sure. We think they're probably not a good thing, but we are not sure exactly how bad they are, and more importantly, what we can do to avoid it. And if we are avoiding it, whether what we're replacing it is going to actually help us or hinder us, right? Whether it's going to cause more problems with what we're replacing it. So, I think we don't really know for certain. The jury is out. And that's one of the reasons why our health service has not said, avoid this, because, there is conflicting evidence either way.
Thank you, Sanjay. Can you perhaps talk us through a bit about what happens next if something is found through screening? What kind of is the pathway going forward after that?
So, I mean, if you have an abnormality found in screening, you are generally very rapidly referred straight into hospital, and it's a pretty quick pathway. So it depends on what the abnormality is. Some abnormalities are very obvious. It's a cancer. Other abnormalities just need more investigations, and it may actually not be cancer at the end of the day, because some screening tests will be abnormal, suggesting you may have cancer, but they may not prove you have cancer, and they may say, well, actually, this is an abnormality, but it's not cancer, which is then a relief. So, for example, if you have an abnormal test, you might be asked to undergo scans, such as a CT scan, such as an MRI scan, such as an ultrasound. Often, if we're concerned about something, we might find a lump somewhere in the body on a scan, and we then might need to have what's called a biopsy. And in a biopsy, under a local anesthetic, a doctor or a nurse would put in a very thin needle to take a sample of that tissue, and that sample of that tissue then gets looked at under the microscope to see whether it's cancerous or not. Some of the times it's cancerous, and then we would then take that forward, depending on how much cancer there is on board, either with surgery or other treatments. And if there's no cancer, that's a big relief, right? Everybody's then very relieved that there's no cancer. It's just maybe an area of inflammation, or it's a growth, but it's a benign growth, not really quite a cancer, so you then don't need to worry. Or it might be a very minor abnormality, and they may say to you, well, look, you need to come back next year to have another screening test to make sure that it settles down, or it doesn't become a problem, or we keep it under review, and then you'd be under hospital care. So it depends on what the problem is, but the best thing to do is to get it checked out.
Great, thank you. Heena, Ben, one for you, and Sanjay, feel free to chime in as well. There's different questions coming through about fasting and also about vegetarian diets in terms of advantages and disadvantages in terms of cancer prevention. Have you got any thoughts on that?
Yeah, it's a difficult one. I mean, there's lots of kind of literature out there about fasting and its kind of health benefits. So fasting kind of can probably help in two ways. So number one is that you're obviously controlling your diet. So that may help with kind of your weight control. So controlling your weight, then fasting can help in that. The other thing is that some people say that, yes, fasting can reduce kind of inflammation in the body, and it could kind of help prevent cancer in that way. But I think maybe small periods of fasting together with a healthy diet, and we'd hope that a vegetarian diet is healthy. Yes, lots of fruit and vegetables, but just to be careful, with the ultra processed foods. So not just to think because you're vegetarian, you can eat whatever you want because you're not eating red meat, etc. But yeah, just to be careful with the ultra processed foods. So I think it's important just to be mindful of your diet generally. So there's no point fasting and then the rest of the time you're eating lots of convenience foods. So just to have an overall good healthy diet, I think is more important.
Great, thank you. Yeah, and I think go on, Sanjay.
No, I totally agree. I mean, the concept that you can eradicate cancer through fasting, I think is really untenable, right? I mean, cancer will not go away just through fasting. I mean, you can, possibly reduce the risk by eating well and eating healthily, as Heena Ben has said, avoiding the ultra-processed foods. But, you don't want to gain weight because gaining weight is a bad thing. We know that overweight people have an increased risk of cancer. But similarly, you don't want to lose too much weight because if you've lost a lot of weight as well, that's also extremely unhealthy as well. You need to find the right medium balance for what your natural weight should be. And if you've got cancer, then actually even more complicated because in certain conditions, you definitely don't want to lose weight. And so this is a very nuanced discussion that you need to have either with your GP or with your oncologist.
Thank you, Sanjay Bhai. The next question is for Heena Ben. Will the HPV vaccine affect fertility?
There's no evidence that HPV vaccine can affect fertility. So there's nothing. I mean, there's some slight evidence that yes, if you've got HPV and then you need treatment for that, then yes, it could affect fertility in that way. But the actual vaccine has not been proven to affect fertility in any way whatsoever.
Okay, thank you. I think we've got time for one or two more. Sanjay Bhai, I know you touched on PSA testing earlier and the importance of doing it at the right time. So when would you advise and how often would you advise that men have a PSA test or seek that advice from their GP?
I think PSA testing is a really thorny issue, and it's a very complex issue, which is why the government have not agreed. Well, let me rephrase that the independent screening committee, which is not the government, the independent screening committee, have not recommended PSA testing for everybody above the age of 50. They are minded to recommend PSA testing for high-risk individuals, patients who have a family history. So somebody, for example, whose brother or father had prostate cancer is at risk of prostate cancer. If you're Afro-Caribbean, you have an increased risk of prostate cancer. And if you're born with a genetic alteration, something called a BRCA1 or BRCA2, BRCA1 or BRCA2 genetic alteration, that increases your lifetime risk of prostate cancer if you're a male. For those people at increased risk, there is definitely no benefit for having it. But for common people like you and me, right, in the street, it's a very nuanced discussion, because PSA as a blood test is not a very good tool to pick up prostate cancer, because as we get older, the PSA level will go up. As our prostates get bigger as we get older, our PSA will go up. If I go for a vigorous cycle ride, my PSA will go up. Now, where is the right balance? You certainly don't need a PSA test every year, maybe every 2 years, but you need to be at risk of prostate cancer for it to be worthwhile, because prostate cancer sometimes can kill you, but prostate cancer sometimes is not going to be something that you will die of. It will be something that will live with you and you will die with. So it may not be an aggressive cancer that needs testing. And this is the sort of discussion you need to have with your GP. In the link, there's a very good PDF about the risks, the pros and cons of PSA testing. I encourage all the males that are listening to this, and even actually some of the females, to have a look at it, to encourage everybody to be aware about the pros and cons of PSA testing.
Thank you. And as mentioned earlier, we did do a men's health webinar as well that we can refer to people to on our webinar series. I'll hand over back to Subnamen.
So thank you very much to Professor Sanjay Popat and Dr Heena Ruparelia for their insightful talks and answering all of our questions. It's been really, really helpful. And this concludes our webinar today. We really hope that the session has empowered you all to take meaningful steps towards a healthier lifestyle and cancer prevention. And we hope that you all take part in regular screening and vaccinations that are available, and seek help at an early time point when you are worried about something. As mentioned before, we have posted some useful web links and documents on the chat for more information related to our talk today. And as usual, this webinar will be available soon on YouTube, along with all of our previous webinars. We do have a short questionnaire from this session to complete. If you do have a few minutes, the QR code is up there, and we'll also post the form in the chat. We've already posted it, actually. If you could do, we'd be very grateful. And we look forward to seeing you at our next month's session, which is on anxiety. So please do look out for the announcements on Telegram. Thank you again for joining. Jai Swaminarayan.